I think third year can be both a really intimidating experience at first, but it's really, really rewarding. You go through all of these different rotations, you're exposed to different specialties, and it's a little bit of a whirlwind tour of medicine because you're learning a little bit about pediatrics for 6 weeks, you're learning a little bit about OBGYN for 6 weeks, so on and so forth. And 6 weeks goes really, really fast because you're in the hospital, early in the morning sometimes, seeing your patients, going on rounds.
One of the other strengths of being here is that we have very, very strong clerkship training. Our clinical experiences and our clinical facilities, the different hospitals that our students can work at, are very rich clinical training sites. And we're very fortunate to have a wide range of clinical exposures, diverse patient populations, and a high level of expertise and faculty expertise.
There are 3 different modalities in terms of our interactions with the medical students, and none of them get assigned to a teaching team when they come here for a block rotation. So when assigned to a team, the residents assign patients to the medical students, so they see these patients and then present the cases when we round as a team. And when we're on call also with the medical students on those days.
What I really appreciate about third year is that the whole, being able to witness education, medical education at all levels of training, from being able to watch attendings teach fellows and residents, those attendings, fellows, and residents also teach medical students, and really being a part of all of that learning. They're very full days, and you come home every day thinking, wow, I've learned so much today. I have so much more to learn. One of the many reasons I chose Brown was that it was a school that the attending physicians really seemed like they cared about medical students. I think other medical schools have a reputation for residents being the only way medical students learn, and we have great residents who do a lot of terrific teaching. But I feel like the size of Brown really lends itself to having attending physicians who are involved in medical school.
Students do incredibly well in their residency match. Our students go into what they want to go into at top-notch institutions. You really can't do better than the residency matches we have.
The students who come through here obviously are prepared for the clinical rotations. You can tell that they have a solid educational background in terms of the theoretical basis of the things that we do. They are very good, and it shows up actually when it comes to the match results, because they end up matching very, very highly competitive programs, be they getting into internal medicine like I did, or any of the other specialties.
I do think that Albert Medical School and Brown are great places to be for innovation. We really do love to think about ways to teach something better or to learn something differently. And I think we very much welcome student input in that, but I think that we're also pretty flexible and nimble in the ability to incorporate things that we think would be great for our students.